Today we're going to talk about the evolution of telehealth. We're going to discuss the origins of telehealth, how it got to where we are today, and the future trends of telehealth. What is telehealth? Telehealth is the ability to heal at a distance with electronic means. Some examples of telehealth is utilizing video conferencing, mobile applications, and actually remote education. Today, what we're going to go through is the origin of telehealth as it relates back to as early as the 1900s, telehealth advances with technology, talking about how the internet really changed the way we were able to view telehealth and telemedicine, and also looking at the role the government plays within telehealth as it relates to the Affordable Care Act, as well as HIPAA, and also reimbursement, how this is also affected by telehealth. Advantages to telehealth: able to better serve rural populations, including better access to specialists, avoids unnecessary travel between facilities or, for that matter, to metropolitan areas. So patients are able to either, from the comfort of their home, if they have the appropriate equipment, uh, talk to a physician or could be a PA in a facility in a more metropolitan area, or it could be that the equipment's at their primary care physician in the rural community, and they're able to go to that facility and then with the doctor there being able to be with a specialist. Also, one of the advantages being able to reduce the admissions in hospitals without having with having the ability to remote monitor. So this goes back to looking at, being able to take your glucose level, like your blood sugars, pulse, temperature, blood pressure. These are all things that there's equipment now that you can actually do this remotely and able to have someone in the medical field monitor and kind of oversee the results without having to come into the facility. Also, remote education. So this has the ability to, you don't actually have to go to a class. There's so much stuff out there on the internet nowadays to where physicians can use this looking up case studies or documents or white papers. Um, you have your patients who not necessarily say self-diagnose themselves, but able to look at websites like WebMD and be able to review kind of some symptoms that they have to determine, do I need to go see a physician now or not? So you're kind of using it as a research base. So what are some types of monitoring tools that exist? Blood pressure monitor, obviously we'll take your temperature and record it. Pulse, oxygen. Even pulse nowadays, I actually have a mobile app on my phone that I have the ability to record my pulse on. It's a very neat application. I did want to provide a very high level diagram of kind of telehealth as it relates from a rural community to a kind of major metropolitan area like a specialty medical center. So let's take you have 100 miles away, you have a rural location. You have anywhere from patient, student, local health provider. And then on the other side, you have your medical center with actually, you might have 100 different specialists that make up a major um, hospital. So what this does now is provide access using, video conferencing, ability to have consultation, case reviews, education, training. Having that direct face-to-face contact is always good to have. It's better than just having a phone call to be able to kind of see the reactions and be able to get a better view of your patients. This is an example I just wanted to show you of a patient that's actually using a blood pressure machine as that's kind of linked to the internet, kind of how that would look and how they would utilize that. Another example is imagine this being in a rural community at a local community hospital. This patient here that you're seeing this bed, let's just say hypothetically might have um, some sort of special or different type of cancer. They may be looking for a specialist to be able to look at the patient, review the symptoms, be able to ask questions, get feedback from that patient. At the same time, you have the healthcare workers, the doctor or the nurse in the room as well, to be able to answer questions as well without this patient having to actually travel to that major medical facility. Some of the barriers of telehealth: equipment costs. This is probably one of the biggest things. It's the startup. I mean, there's a lot of equipment to buy from, if you think about televisions, um, video conferencing equipment, of course, internet, making sure you have the right speed. Is it like a T1 line? So a lot of startup companies that happen, a lot of facilities that look at using this, um, they lose that kind of initial seed money, and they don't have that kind of continuing revenue coming in to keep it going. Now, this traditionally now is not happening as often because actually as part of IC9, actually ICD-10, Medicare, Medicaid in some instances are actually reimbursing some of the costs of telehealth, telemedicine, which is actually really helping kind of telehealth take off even more. I mentioned reimbursement. Medicare, Medicaid is doing certain things for telehealth reimbursement, and some commercials are actually starting to embrace this as well. Education learning curve. So this is more going to be kind of for the patient side that aren't really as familiar with electronics, but if you're going home and you have your own blood pressure machine and you need to make sure it's hooked up to the internet and have your webcam ready, and so you can be dialed in for video conferencing if need be, this could be a learning curve for some patients if they're not as technical savvy. So kind of looking to see how can we curve this, maybe have a tutorial, a quick step guide. So here's a kind of a timeline of telehealth. So in the early 1990s, sorry, let me back up. Actually, the roots of telehealth go back as far as 1906, when Dr. William Einthoven, inventor of the EKG, developed a way to transmit data over telephone lines. Not until the 1950s, when a remote clinic in Nebraska used closed-circuit television connection to a hospital 100 miles away, did the thought of telemedicine really come to fruition. Before that time period, there was never a thought this sort of technology was even possible. In 1955, this was cutting-edge technology as far as the internet and FaceTime not being part of everyday life. So really, once we got into the 1990s and the internet really took off, did we actually help bridge the gap to really bring from a remote session to a facility as actually a possible? So this actually started kind of more of the focus on telehealth. Now, in 1996, when HIPAA was brought into legislation, this in the privacy, this was a big thing because obviously using the internet and privacy was always a big thing on people's minds. This helped kind of put guidelines in place and really got telehealth moving forward. And then in 2010, kind of now on the reimbursement side, how do we get paid for this type of medicine? As part of the Affordable Care Act, there is actually now reimbursable procedures or tests that can be done and be billed for, and the facility will get reimbursed for. Medicare, Medicaid really, or on some items are doing this. Some of the commercial insurances are starting to take off on this as well. Who benefits from telehealth? Patients in rural areas, even communities. It's keeping the patients in the community and not taking them outside because they have to move because they need special types of treatment. Providers able to do more with less. Physicians with being able to monitor a patient without having that patient have to come back in to get on the schedule. And payers are going to benefit from this to hopefully the rate of readmissions are cut back on being able to monitor this patient in the home, and if the patient needs to come in, they can bring them in at that time to where the unnecessary visits are cut back. The Affordable Care Act is actually instituting penalties on readmissions. So I see this as a great point for telehealth, where you can monitor these patients and be able to determine if they need to come back in. If not, it may be home health or maybe a nurse that goes out to visit that patient that can prevent that patient from having to come back in the facility, because these penalties are cutting into their Medicare reimbursement. And doing more with less, as I mentioned earlier, changing the culture, trying to get the emergency room not being the primary care facilities, which emergency room is very costly and expensive. It's used today through remote monitoring, mobile technology like fitness apps, monitoring steps, heart rate. You can do all kinds of things. You can input what you ate. So really track what you're doing in kind of everyday life. And they're only going to get bigger and better. And our Apple Watch, iWatch is coming out. Education. Physicians are, you're being able to have direct access to documents, case studies, um, calculations, patient more for kind of self-diagnosis like WebMD. With an estimated 200,000 shortage for primary care physicians by 2018, we have to know how we can do more with less. Think of Redbox, how you can go rent DVDs. Can you imagine a kiosk that you can go into, it's secure and private, and be able to have a consultation with a physician? And then really, I think with mobile technology, that's really going to take off more with Bluetooth capabilities, to where there's more monitoring in place that can kind of communicate back to your physician so they can kind of be able to see progress or potentially issues that may come up and maybe be able to remotely schedule an appointment with the patient. In summary, rural communities are going to benefit from this, increasing our education. I think privacy is a big concern. This will continue to probably be modified as technology grows, and telehealth and telemedicine, I believe, really will be a major part of our life going forward.